as a virtual name game. How this goes is that we will introduce each other by saying our name followed by an adjective that starts with the same letter as our name. I'll go first. Hi everyone, I am supportive Sahiti. You can either unmute yourself when it is your turn, or you can either unmute yourself and share your name along with the adjective, or you can put it here in the chat box. We have 2 minutes. Let's introduce ourselves in that way. Hi, I am supportful Sahiti. Can I have Zuhi or Divya to start this? Yeah,
Hello everyone, I'm Joyful Juhi.
perfect, perfect. Joyful Juhi. Next.
Hi, I am Anamika.
Okay, okay.
Hi,
Anam,
I'm ma'am, I'm delightful Divya.
perfect, perfect, Divya. Next.
I'm Savior Sunita.
Oh, that's amazing. That's amazing. Thank you for that, Sunita. Next, next. It's a fun way to introduce ourselves. It's wonderful to hear when we think about even creating an adjectives that we choose to describe ourselves. This is not just an activity to introduce, but it also gives us a perspective or insight on, I would say, how we see ourselves. So, yeah, a couple more people.
Hi, this
Oh,
is Creative
sorry then,
Devoshita.
I'm adorable Anamika then.
Anamika, I'm really sorry, Deboshmita. Yes, Anamika.
Adorable Anamika.
Oh, perfect, perfect. Yes, Devasmita, please go ahead.
Creative Devoshmita.
Oh, creative Devasmita. I see admirable Aisha, active Aishwarya. Oh, these are amazing. It's amazing to hear such a wonderful adjectives. Would anyone want to go ahead? We still have a minute more to start the workshop. Would anyone want to take a
Hello everyone. I am versatile Vanika.
versatile Vanika? That's amazing. That's amazing. Would anyone else want to take a chance with
Yeah,
that?
this is Fantastic Archana.
Archana, could you repeat yourself?
Fantastic Archana.
Oh, that's amazing. Meaningful Muskan. That's amazing. Ashrita, would you want to take a go at this?
Hello everyone, I am Sonu, Critical Sonu.
Okay, okay, that's good. That's good. Okay, thank you for sharing it. I'll be sharing my screen. Do let me know if that is visible for everyone or otherwise.
Yes, hello.
Hi, I am Zeba. Zeba Zenith.
Is your screen visible to everyone?
Yes, we're able to see Saiti.
Okay, thank you. So I'm doing a slideshow, which means I cannot see or I cannot see videos all that are there. I really
Good
request.
evening, ma'am. Good evening, ma'am. This is Anjali.
Good evening, Anjali. Yes, thank you for sharing that. As I was saying, if I ask a question, I would really require, I would say, answer in terms of an audio answer because I cannot look at the videos. Is that clear with everyone?
Yes, Saiti.
Y-
Perfect.
Yes, ma'am.
Yes, we have done the activity of introducing each other with a very cute adjectives of saying who we are. Now we'll dwell into what is the importance of communication in counseling. Building a therapeutic alliance, navigating emotional expressions, and promoting kind anatomy and minimizing miscommunications and misinterpretations. Building a therapeutic alliance, what I mean to say by this is that effective communication is very essential for building a very strong therapeutic alliance between the counselor and the client. You know, the therapeutic alliance. Okay. Can anyone help me understand what do you understand by therapeutic alliance? Anyone?
Is it like you make the connection with the client, like where client starts trust you and like open up about their problem?
Yes, yes, that is one way to put it. Thank you so much for sharing. Before I ask another question or I tell other person to answer this, I would like to say one thing. There are no right or wrong answers. Every answer is a right answer. We just have to modify a little bit. So please feel free to open. This is a very safe and non-judgmental space. So you can share whatever it is that you think you know. So please don't worry, there are no right or wrong answers. At the same way, if you have any doubts, please feel free to open up and feel free to ask because every question is an important question. Okay. Would anyone else want to go and have a take on what is a therapeutic alliance?
Interaction between the counselor and the patient.
Perfect. Perfect. Anyone else?
I think it's the relationship that both counselor and client share in the space.
Perfect. Perfect. Combining everything, a therapeutic alliance, it mostly refers to a collaborative relation which the main goals or the main characteristics of this relation are a mutual trust that is there between the client and the therapist, and the respect that is there between the client and the therapist towards each other, and the shared goals. What are the goals of the client in terms of therapy session? What are the goals of a therapist in terms of therapy session? All of this combined, it refers to as a therapeutic alliance. Now, what is the use of this therapeutic alliance is and why is it important is because it completely enhances the client engagement in the whole therapy session. It increases motivation of the client, it increases the motivation for change, it increases the motivation for improvement, and it also improves treatment outcomes of this whole therapy process that happens. Okay, are we clear till here? I'm
Yes,
presuming. Thanks.
Yes, ma'am.
Now, navigating emotional expression. So, counseling often involves exploring very intense emotions and very strong emotions, or sometimes unpleasant emotions like sadness, fear, guilt, or shame, or anger, so on and so forth. But the plus part of the I would say here, communication plays a very important role by enabling the counselor, that is us, to navigate these emotions in a very empathetic way and in a very sensitive way where the client is feel seen and heard. Okay, apart from that, it is important for us as a counselors to be able to create that safe space for clients where they are in a situation to express their emotions openly and without judgment. It is our duty to see that there is no judgment there, and also while helping them to explore and understand the underlying causes and meaning of these feelings. Okay, now promoting client autonomy. Okay, again, how is communication related to this is that effective sorry for that, effective communication actually empowers clients to take an active role in their own therapeutic journey, and uh, it makes them feel that they are informed about every decision that is being taken in the therapy process, and they are in control of their life and this whole journey as well. And by fostering this complete autonomy and self efficacy through having a proper communication sitting and doing a very collaborative goal setting, exploring all the options that we have, and providing a proper psychoeducation, that is required for the client, and all of that. As counselors, we can help clients develop the skills and confidence to overcome the challenges that they face, to overcome the resistance that they face, and achieve the goals. And the next point, minimizing miscommunications and misinterpretations. The one way to, I would say, uh, clarify all the misinterpretation, miscommunications is communicating very, very clearly. This is where effective communication skills come in picture, which actually help the counselors to completely minimize the risk itself, not the damage control, but minimize the risk of miscommunication by actively listening to them, paraphrasing. We'll get into active listening, paraphrasing with an examples in the coming slides. But the one importance, the main importance, last but not the least importance, is completely minimizing the whole risk of miscommunication and misinterpretation. uh, are we clear till here? I'm taking that as an yes. And I'm moving to the next slide. Types of communication. We all are aware that communication is speaking, communication is talking, right? But we do have different types of communication. Some of them are listed here: verbal, vocal, bodily, touch, and taking an action. Okay. Now, I would like to stop sharing my screen, and I would like to keep this as an. How do I stop presenting it? Sorry. Yeah. I would like to give this part as a very interactive part where we speak about things. Now, what do you understand by verbal communication, or what do you mean? What are your thoughts on verbal communication? Anyone? And again, I would really like to put this point across. Every answer is a right answer. Please feel free to answer this. This is a very safe and understanding space, judgment free space. All of us who are here are psychologists or students in psychology, so we know what is it. So please go ahead. Please go ahead and answer it. What do you understand by verbal communication?
Ma'am, verbal communication is mean like have to interpersonal skills like small group of communications also we have
Okay,
and
okay.
public speaking.
Understood. Thank you, Divya. Thank you for that. Pratyusha, you were answering?
Yeah, ma'am. Expressing ourselves with the help of words.
Request you all to mute yourself. Request you all to mute yourself. Only the people who are answering can unmute themselves.
It can be verbal and written.
Okay. What? Okay. Anyone else? Anyone else would want to speak about verbal communication skills?
It's what we speak by words, like what I am speaking. So
Okay.
that
Okay.
is
Okay. Good. Thank you so much for that. So, verbal communication is the message that is sent using words. As we in therapy sessions, we mostly use these words like, "I understand. Please tell me more about it. What makes you think like that? Okay. Do you have any proof of what you're thinking?" So these kind of words that we use, these come under verbal communication. And as a counselors and as a trained professionals and empathetic listeners, we should consider a couple of things while we are practicing this verbal communication, which everyone does. Is a language too formal or too informal? I believe there is a very, I would say, very thin line in terms of counseling between informal and way too formal, being too friendly and not being friendly, all of that. So as a counselors, for us it is very important to understand where the client stands at, and how formal is too formal for the client. Because if we be very formal like a corporate language, there are high chances that the client may not connect with the therapy process at all. So question yourself: is it too formal, or is it way too informal? Like, hey, buddy, what's happening? Oh, this is late. All these kind of terms, all this slang, this is way too informal. Okay? Is that so? I understand. This is way too formal, or this is way too robotic. So we have to find the middle balance between being too formal, being too informal. And apart from that, what is the whole context of the conversation? What are the content and the focus on what we are having a conversation about? So for example, let's say we have set goals for that whole therapy session, and sometimes we find ourselves derailing the goal and moving away from the goal. So it becomes our responsibility to understand where the client is coming from, and why is it that they are saying what they are sharing. So this we call witnessing the story of why the client is in the situation where that they are in, and understanding the whole focus of the point. Okay. And apart from that, how much is said? Sometimes in therapy sessions, it is very usual for clients to speak. It is very usual for the clients to speak way too much. Sometimes there can be whole, I would say, 3 to 4 sessions where the client keeps on sharing their story, and sometimes it's all right, but you also have to understand the difference. I'm so sorry. You have to understand the difference between client intention. Is the intention of the client for for the whole therapy session, that session, is it venting, or is it immediate fix, or are they looking for both? So that will also happen while communicating. That will also happen through verbal communication. Okay, are we clear? Vocal communication. Can anyone help me understand, or can anyone tell me what is your take on vocal communication? Sorry for that. Yeah, vocal communication.
I think it's with the tone of the voice that we use during the sessions.
Exactly, exactly. So, how we talk, it can have a huge impact, and it can set the whole tone for the whole therapy sessions and the whole therapeutic alliance that we have. Message sent through these voice are very important. For example, I'm just taking Zuhi's name. For example, let's say Zuhi is my client and I'm a counselor, and Zuhi says, Sahiti, I'm really feeling sad because my exams are coming up. Oh, your exams are coming up? Oh, I see you're sad. How does this sound? And the other sound, oh, I see your exams are coming up, Zuhi. How are you feeling? How does this sound? The voice modulations that we make, and the pitch that we use to speak. I'll just give one very example. Zuhi, what are you doing? Zuhi, what are you doing? The pitch that we take as well, and I would say, the emphasis on a specific statement. Let's say Zuhi states that she is stressed. Zuhi, I really see that you're very stressed, by considering or by the exams that are coming up. What else are you feeling? I see that you're feeling very stressed. Is there anything that you're doing to help with that? You're completely focusing there and you're emphasizing on the whole feeling of stressed, right? Emphasis on a specific statements or emphasis on specific feelings. All of this come under vocal communication. Just to sum it up again, vocal communication involves the volume, the way that we whole articulate the whole sentence or a couple of words, the pitch that we take while we're having a conversation with a client, and the speech rate. Hi Zoe, how are you doing? Oh my god, I see you're stressed. Oh my god, what is there? Is there anything that I can help you? The speech rate, not too fast, not too slow, a proper speech rate where the client can hear us, where the client can understand us. Okay, all these, they come under vocal communication. And the next thing is bodily. Yes, yes, Divya, please go ahead. I hear you have a doubt.
Yes, the
Yeah.
vocal communication, you said about the pitch and the type of tone we use in vocal communication. It
Yes.
can be different when we do a one-to-one counseling, and in a group counseling, it should be like a little bit authoritative, I think so. Is that right,
Yes.
Sarati?
Yes, that's a very excellent point that you have taken. Thank you so much for taking that point. Yes, sometimes what happens is while we do a one-on-one session with the client, it's just you and the client. It doesn't have to be the volume that I'm using as well. I am using this pitch that I'm using because there are, I don't know, 20 to 30 people in front of me who should hear me out, and my system is this side at a very far away space. Okay. Now, at the same time, while in a group session, as Divya has told, in an online setting, again, it's a whole different way that we take it ahead. We don't have to shout. Whereas in an offline setting, we might have to raise our pitch a little bit so that everyone can hear it, right? In an offline setting, while giving a workshop or while giving a session, our whole focus is on how everyone can hear it and how we can share the information with everyone, right? In that cases, it is all right to raise the pitch, but with the same empathetic level or with the same sense of communication that we have. Divya, is that all right? Did I answer your question? Okay, perfect. Thank you so much. Now, coming to bodily communication skills. Yes, what is your take on bodily communication skills? I really want this to be an interactive session, people. I am not a lecturer. I am not here to lecture you on things. Let's keep it interactive. Let's talk to each other. Please go ahead. As I keep on telling again, there are no right answers, there are no wrong answers. Everything is a right answer. We just have to modify a little bit. Don't worry about it. It's a whole safe space here. Please go ahead. What do you understand by bodily communication skills?
When conducting any one-to-one session, we must have an eye contact with the client. And another thing is we must be more attentive to the client as well. That is more important, I think so.
Perfect, perfect. Thank you so much for sharing, Divya. Anyone else? Anyone
And the
else?
gestures we make after listening to the sentences, what they speak, we should be very careful with our facial expressions.
Perfect, perfect. Understandable. Anyone else? Anyone else?
Reciprocating with the client's feelings and emotions.
Okay, understandable. Completely understandable. Good point. Okay, I'll give you one very small example here. I will take, I can only see Zuhi and Mahi here. Mahi, please don't mind me taking you as my client right now. Oh, is it Mahi? Okay. Oh, okay, okay. Okay. How is this feeling? Okay, please go ahead, Mahi. I'm here.
Ignorance.
Exactly. Right? So the way that you look at a client, the way that you be in front of the client, and the way that you show the client that you're there, you're present, that matters a lot. And one of the way that we can do, I'm so sorry, one of the way that we can do is through bodily communications. Sometimes we tend to look at our nails way too long. Maybe we have had a good nail polish on that day. Or sometimes we tend to focus on ourselves, the way that we trust, the way that our hair looks, all of that. I understand. But it should not affect the bond, or it should not affect the therapeutic alliance that we have. It should not affect the whole therapy session. Concentrating, showing the client that you are concentrating through your bodily gestures or through your bodily expressions or body language, that is very important. Sometimes we forget to consider that our whole body can communicate, and yet it can completely significantly have a huge effect on the communication. It can either add or distant from the client of what we are saying. As I don't remember, someone else told, uh, I would say, showing the client that we understand their feelings in that sense, and that is an excellent point. That is that. Now, touch communication skills. This is a very touchy topic. The name itself says touch communication skills. What is your understanding by that? Excuse me while I drink some water. Yeah, touch communication skills.
Is it like if a child is young and he's not able to express his or her feelings, so then in that case we touch the child, we pat the child, we like make the child comfortable so that he can like share the problem with the counselor. Is it like so?
Yes, yes. Good point, Monica. An excellent point. Anyone else? Anyone else?
It's just like we tap on the shoulder to encourage, on the head that it is fine, okay.
Yes, yes. Perfect, perfect. Okay.
And
I
sometimes if they are emotional, then we can hug them. If they are venting it out, we can hug them. Like if it is mainly girls.
Okay, that's a good point. That's a good point, Sunita. And that's an excellent point. While appropriate, a very gentle touch to the arm or on the shoulder. Rahila, yes, please go ahead.
When it comes to touch, so mostly nowadays what I see is most of the students, the girl students who are coming to me, uh, when they speak about themselves and we hold their hands, it gives them some kind of confidence and they open up in a more subtle way. Just holding the hands, give them, I don't know, the vibes that they open up in much better way and they feel relaxed also. So I guess holding the hands in such a way that giving them that protective that okay, we are here for you.
Perfect.
That matters a lot.
An excellent way to put it, Rahila. A really excellent way to put it. Now, okay. When appropriate, again, this is very, very important. When appropriate, this whole word, when appropriate, a very gentle touch, as Rahila told on the arm, like, it's okay, I'm here for you. On the arm or a tap on the shoulder, it can communicate as much as and it can communicate more than what we can say through words. I'm sorry. But then it is one very important thing to remember that physical touch, again, a coin has two sides. Physical touch, it has very excellent side of the coin where it states to the client that we are there for them. Some, as Ahila told, it shows you know, it sometimes unknowingly gives a sense of positivity, a sense of good vibes or a trustworthy vibes, or it communicates that we are a safe space. But then there is a negative side, which which has the risk of over familiarity and also inappropriate interest. Okay, so what I generally follow, or what I try to follow, is if it is a again, one thing, consent is always, 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 always important, no matter what. Be it a small child, be it a double the age of you, the person is the client. Consent is always matters. Whenever I personally, whenever I take a session with a client, if it is an offline session, what I generally do is it okay if I give a shabash on your shoulder? Is it okay if I do that? Would you be comfortable if I do that? And sometimes they're okay with it, especially when I see that they have done their homework. The first thing that I ask is it okay if I just give you a shabashi on your shoulder? And sometimes people say yes, sometimes people say no. And when they say no, the one thing that I do is, can we actually do it now? Whoever turns on your video, can we actually do it now? A very simple, small, 2 seconds exercise. Put your hands up, facing palms facing you, turn them back, give yourself a shabashi. Yeah, you can do that. Yes, that's it. That is the self shabashi way. I do that. People actually like it, giving themselves a shabashi. That's one thing. And as Rahila has told, just while you're taking an offline session, when the child is crying or when the child is sharing something very emotional or something which is very heavy for them to share, it is all right to just tap on the arm and say, that's all right, I'm right here for you. These statements on and this touch, it can communicate that we are a safe space for them. Again, it is very important to ask for consent. We say to kids that consent is important, so let us follow that. Okay. Is it clear till now? Any doubts? Anyone? Okay. The last type of communication, take action communication skills. Can anyone tell me what that means? taking action communication skills. Okay. While we think that communication is always face to face, or communication with a client with a client happens only when we are in therapy session, there is a very slight addition to that. Communication is not always face to face or happens in the session. Reminders that we send to the clients: hey, we have a therapy session at so and so time, hoping to see you there. Or sending them the homework and maybe checking up with them saying, hey, I did send you this homework. Is there anything that you need my help in, making you understand how to do the homework? And following up with them, and further communication regarding the exercises that you have shared, regarding the readings that you have shared with them. For example, what I generally do is, when my client wants to, okay, I'm a very booky person, and what I generally do is, when my client wants to uh, have a deviation from their routine, the one thing that I suggest is read a book. And if the client is okay with it, I will discuss about the book in the first 15 minutes of the session. And sometimes that actually has a very positive impact on the whole therapeutic alliance that we have with our clients. Or my therapist, while I was going to therapy, and still my therapist has suggested me to watch Friends. That is how I started watching Friends. And my therapist made it very sure that she discussed about Friends for the first 15 minutes of the session. And it's been 4 years, and I trust my therapist more than anyone else. So that the rapport building, the therapeutic alliance is formed through that. The client, at least for the first couple of sessions, sending a very subtle reminders ki, hey, we have a therapy session coming up, hoping to see you there. That kind of reminders. If you're in school and a kid comes to you, you have given them exercise. If you find the kid maybe after a week or so, and your next therapy session is coming up, maybe if the kid is alone or walking to somewhere, and if you find the kid without anyone around, maybe you can just ask them, hey, I hope you're finding it easy to do the homework. Do you need my help in making you understand on how to do the homework? That kind of subtle interactions with the client off of a therapy session, these also come under communication skills. Okay, are we clear? Are we clear till now? Clear, everyone?
Yes, ma'am.
Perfect. Thank you so much. I'll share my screen again. Can you see it? Is it visible?
Yes, we are able to see.
Thank you for that. Now, we have talked about types of communication skills. Why is it important? Let us discuss about core communication skills. Okay. Again, since we all are psychologists, I'm the students of psychologist. I am sure you must have heard about all of these things: active listening, empathy, non-verbal, open-ended, reflection, paraphrasing, and summarizing. About non-verbal communication skills, we just have discussed everything. I hope that part is clear for everyone. I'm thinking that as an yes. Now, moving to active listening.
Yes.
Okay, no. Moving to active listening. Okay, what is your, you know, what is your take on active listening? What do you mean by active listening? What do you understand by active listening?
Literally
Being
getting into
available
their
to the
shoes.
client.
One by one, please. One by one, please. Manisha, please go ahead. Then Sunita will go ahead.
So, active listening is completely being present with the client,
Perfect. Perfect.
is my understanding.
Perfect. Sunita, please go ahead.
It's like just getting into their shoe and understanding what they are going through.
Perfect. Anyone else would want to have a take on that? I mean, take on active listening? Uh,
To
The
just
amount
put
of
our
information we
whole
get.
attempt.
Shivangi, Shivangi, one second. Rishikesh, please go ahead.
Yeah, means active listening is important because I feel like sometimes, like, I mean, just we are discussing about like touching and all like that. So maybe it may happen. I have another gender like patient, so that time
Yes,
maybe it will
yes.
not work. So I can only do with my like voice, and like maybe sometimes if the patient is like little bit introvert, not opening up, maybe I may raise my voice, like showing more positive to gain the confidence, and try
Okay.
to listen, really listen, like what they are trying to say.
Oh,
And
that's
sometimes active listening helps us to like understand what they are not saying also.
okay. That's an amazing point that Rishikesh has put. If you have a opposite gender, and if you as a counselor are not comfortable with, thank you so much for that. I missed that point. I missed putting out that point. If you have an opposite gender client, and if you're not comfortable in going for the touch communication skills, that's all right. That's all right. Okay. Shivangi, you were saying something. Shivangi? Yeah.
As Rishikesh said, that it's not always like to make that client understand that I'm listening, I'm like hearing them, hearing their problem out. We can just, lean a little forward and like nod our head, and we like, like give them that positive feedback that yes, I am here listening, so that they understand that yes, I am being heard. So that is what active listening is from my perspective.
Okay, that's amazing. That's amazing. And Shashikesh, thank you for suggesting one more point. Whenever you have to talk, please use that hand raise button so that I understand there are people who want to talk and we can talk. Otherwise, it will maintain the decorum of the whole webinar. I hope that's all right. Thank you so much for that. Okay. Now, as said by all of you, active listening is being present in the full conversation, showing interest by practicing a very good eye contact. You're saying something, please go ahead. Oh, okay. This is not active listening. If the client is here, focusing on the client, showing a good eye contact. Okay, that is one example of active listening. Noticing non-verbal cues that a client gives. For example, when a client is stressed or anxious, you see them playing with the cuticles of the nails. You see them, you see their hands either chipping off their nail or the cuticles of their chipping off the cuticles of their nail, or nail biting, or this sounds. They make this crackling sounds. I hope you can hear it. They make these crackling sounds, or they be very fidgety. All these are non-verbal cues, right? Going ahead with them and asking open-ended questions. We'll come to open-ended questions soon, and practicing all the other basic skills of counseling, like listening to understand rather to respond, and withholding judgment and advice, and yeah, paraphrasing, reflecting, and all of that. All of this, they come under active listening. Now, empathy. We all know that empathy is the ability to put yourself in others' shoes and experience their struggles as if they are your own. Okay? You all understand that this is empathy, right? Now, let's do a very small exercise about empathy. I want three people. I'll be the client. I want a person for option A and option B, please. Uh, See, I'll be very honest. Either you yourself volunteer or I pick names. I'm very brutal in that sense. So, okay, Varnika. Very good. Varnika, sorry. Am I spelling it wrong?
And Vanika.
Vanika, I'm so sorry. Yes, Vanika
It's okay,
will
ma'am.
be option B. I mean, oh, in the coming slide, I'll be the client. Who is option A? Who will be option A? Anyone? Shivangi, you be option A. See, I've told you. Either you volunteer or I pick up.
Yes, ma'am.
Shivangi is option A here. Now, okay, this is here. I'm your client. Okay. You both are my therapists. Got it? Okay. Hi. So I've got so many things to do, and my to-do list keeps on increasing and increasing. It goes to pages and pages. I don't know where to start, and I just can't bring myself to get out of the bed. God knows about to-do list. I don't know what I'll do. Option A for Shivangi. Shivangi, your option
Yeah.
A. Please go ahead. Read out what is there.
Okay.
Just read out what is
You
there.
are unable to get up.
Just read out what
Ma'am,
is
wait.
there.
Ma'am, yes. Come on, you can start by getting out of bed. It's the first step. Please, it's not that hard.
Okay. Option B, Vanika, please read out what is there.
I can imagine how overwhelming it must be when there is so much on your plate. It must be hard when you cannot get yourself out of bed. How can I help you?
Okay. Out of these two, which sounded empathetic?
B.
B, ma'am.
Okay. Why?
B.
The way the words
Why
are
did B sound
the way the words are
empathetic?
put,
Okay.
that is
Okay.
empathizing, that is like motivating, and yeah, like the person is asking how can I help you. So it's like even if the person listens, like it can be a great help.
Okay. Perfect. Perfect. Yes, Azra, please go ahead.
Option B is more effective because the counselor is viewing things from the perspective of the client.
Perfect. Perfect. Amazing. So, yes, I'm really sorry. Psychological counselor is the name. I
Anjali.
Anjali, yes, Anjali,
Anjali.
please go
Yes,
ahead.
ma'am. Here the word I can, that is more empathetic.
Yes, yes. Thank you for that.
Yes,
Shivangi, I'm
ma'am.
really sorry that you had to read out option A. It's just the exercise that we're doing. I hope you're all right with that. Are you okay?
Yes, yes, it's just a role
Perfect.
playing, right?
Okay. Now, yes, perfect. Now, the way that you show that you're empathetic, yes, Rishikesh and then Anjali again. Rishikesh, please go ahead.
Yeah, I wanted to ask, like, suppose we face this issue with the teenager. Maybe parent have bought the teenager, but
Yes.
teenager is not asking for the counseling and not making any eye contact and all. So at that time, like, how do we start the conversation and all? Like, uh,
When the
you
teenager
think,
is not, help me understand. What I've heard is that the teenager is not interested in counseling,
yeah, means
right?
it's like kind of resisting itself, like because they don't think that they are having any problem. It is the parents or
Okay.
maybe somebody friends. They are thinking that that is the problem. So
Okay.
so
Understood.
and then it is like me who has to break the ice because now they have come. So like what uh, the way, like what the tips you can give, like to start the conversation with.
Okay, understood. So Hrishikesh, I'll give you from my knowledge that I have. It depends on context to context again. And I understand that you're saying that the teenager is not interested in the counseling and the parents has brought them for counseling. You're asking on how to engage with the teenager, right?
Yeah, means actually the person
Yeah.
whom they want.
Okay, so for the whole audience, I'm repeating the question again. How do we, I think, thank you so much for asking that question. How do we bring, or when there is a situation where the client itself is not interested in counseling, how do we break the ice? How do we continue with the first session itself? Again, from my understanding, I think it depends from scenario to scenario. The first thing is to understand or make the client or make the teenager feel that it is all right to not be interested in counseling, but since they are there, what is it that they want to do? Okay, I would like to take this with a small example in one of a therapy session that has happened. Okay, I'll take my own example. The first, I remember my first therapy session with my present counselor. I was not interested in therapy sessions because, again, context matters here, because maybe I have had very bad experiences with therapists. Maybe I don't believe in therapy. Maybe I don't understand what is therapy. Maybe there is a lot of stigma in me that therapy means giving, that the person will give medications and I will feel drowsy. So there are a lot of, it's a multifactorial thing where there are a lot of things attached to the whole point of why a person is not interested in therapy. It is important to understand that. And from your understanding, from your words, I understand that the kid thinks nothing is wrong with them. Perfect. We understand that. Now, in that case, I think we can go for a very small exercise. This is an exercise given in solution focused therapy where we ask the kid, it's okay. I believe that there is nothing wrong with you. Okay, we'll keep that there. Now, since your parents have brought you here, since you're here anyway, why do you think your parents have brought you here? Ask this question. This would make the kid think on why is that he's here. And the next way to go about I'm sorry, and the next way to go about is, if you were to leave the whole therapy process, if you were to take the whole therapy, let's say 8 or 10 sessions, what is the outcome that your parents are looking for? Or how do your parents know that this therapy session was successful? While asking these questions, what we are doing here is we are validating what client is feeling. That is, they are fine. We are validating that feeling. At the same time, we are also trying to understand why the parents have brought them here. Obviously, parents will say their side of story. Completely understandable. We also have to understand the client side of story as well. So this would make us understand how the kid sees their parents and what is the bond between the parents and the kids. I hope I was clear. Anyone like Ashita, would you want to have a take on this question? Anyone else? Would you want to have a take on this question?
I would like to answer, Sahati.
Yes,
I
sir.
deal with teenagers, right?
Yeah.
So, first speak separately with the kid after listening to their parents. Tell the parents to go out of the room and interact with the kid. That is the first point. And like you said, you can solution focused you can use, and ask him like what he is going through, what are his concerns. We heard about the parents concern, but right now I want to listen to you first, not about your parents. That we can say.
Perfect, 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 Sunita. Anjali and then Shivangi. Yeah, Anjali, you want to have a take on this question? I see.
Yes, ma'am. Yes, ma'am. I deal with primary children most of the time.
Okay,
Hello.
okay.
Yes, ma'am. So most of the children they come like, ma'am, we want to talk to you. Like it is most of the time self-referral for these children,
Okay.
and they share many things which they till date they didn't share with their mothers.
Mm-hmm.
So firstly, I ask them about they themselves, how they are. Then
Okay.
later on, ask what is the concern for mothers there.
Okay.
Then later on, they slowly open up, saying, "This is the matter. This we were hiding this from our mother."
Okay.
And later on, slowly they develop that interaction into a more intense way of talking.
Perfect. Perfect. Perfect, Anjali. Thank you so much for that. Shivangi.
Ma'am, what happens is like when if some parent is complaining regarding their child and like they have been sent for therapy. So what
Mm-hmm.
I prefer is like I say that okay, the now the your parents have sent you here, so there is no going back. We anyway have to talk. So
Yeah.
like, why do you think your parent have sent you here? So they will provide some answer that because of certain like I don't know why they sent me. I don't feel like I don't feel there is any problem. So then I try to ask them like make them say it like okay, so suddenly like something have led to this conversation that uh, you have to visit a counselor or somebody. So what conversation made it? So I go back to the point or the conversation which has like led to this decision of bringing to the counselor, and then like that I go to the matter of concern from like which will be said by him, not by like not suggested by me.
Okay, that's amazing. Everyone, thank you so much for contributing. That's an amazing thing. Hrishikesh, I hope we have answered your question. I'm taking that as a yes. So, yeah, we're moving on to the next thing, open ended questions. Open ended questions, we all know how they mean to encourage the person to share what's on their mind. It can help them expand their own understanding and their own feelings and their situations. And, they're not okay. One main thing about open ended questions is that it is very much important to understand that they come from the place of empathy and not from the place of being intrusive or curious. They come from the place of concern and empathy, but not from the place of curiosity. It is very important for us as a counselor to remember and understand the difference between empathy, sorry, difference between curiosity and concern. Okay, and they are free from bias on from our end. Yeah. Here, you have one, two, three, four, five, 6 questions. We have 6 questions. The client says, my parents are constantly pressuring me to study something and I don't want to. I don't know what to do. Out of these 6 questions, how many of them are open ended questions and how many of them are close ended questions? Okay, close ended questions are questions where the answer most probably can be yes or no. Okay, now anyone? How many? At least you can at least can you at least pinpoint one closed-ended question here?
Are you
Are you
feeling
feeling
bad?
bad?
The second one, ma'am. I'm feeling that.
Perfect, perfect. Mahi, you were saying something. I couldn't hear you.
Yes, I said, are you feeling bad? The second one.
Okay, perfect. Okay, that's a close-ended question. Thank you for that. Next.
Do you want my help?
The third one too. Are you comfortable talking about more about this?
Oh, perfect, perfect. Next.
How can I best support you?
Uh, Sunita, help me understand. How do you? Uh, can you please help me look at that from your perspective on how can that be a closed-ended question?
Do you want my help?
My support. Do you do you need my support?
Okay, okay, okay. Understood. Yes. Pratyusha, you told you want my help. Yes. These are closed-ended questions. However, open-ended questions are that sounds really tough. How do you feel when this happens? This question it gives the client the whole space to explain everything that they are going through. Okay. I hope you're clear. Now, coming to next thing that is reflecting and paraphrasing. This is again an exercise-based slide. Okay, so reflecting and paraphrasing is reflecting. I'm so sorry. Reflecting is where we reflect back the feelings that the client is feeling, whereas paraphrasing is we paraphrase the thoughts. Okay, the one thing that we have to remember is not to repeat the whole verbatim what the person has told, as it could sound very, very robotic and it gives a whole impression that you haven't really understood. Your ability to paraphrase, that is, rewords uh, what's been said to you, can completely, can allow the person in the distress to see the situation in a more clear way and from a very different perspective when we repeat back to them. Okay, it's also possible than that an unconscious, okay, how do you put it? Okay, let's not go there, but yes. Okay, so reflecting and paraphrasing takes in what someone is saying to you, process it in your brain, put it out without adding extra words, but put it out what they're feeling and what are their thoughts. and different ones. Okay, now all of you are my therapist. Okay, I am your client here, and I come and say to you, ki, oh my god, I really hate this. My parents have put so much pressure on me, and it's not fair. Okay, it's just not fair. It completely stresses me out further, and it doesn't allow me to concentrate while I study, resulting in even I'm doing more worse than this. I come and tell this to you. Okay, as my therapist, as my counselors, I want you to reflect on it and paraphrase this. Please go ahead. It's open to you. Please paraphrase this. Uh, yes, Manisha, please go ahead.
So, the way I would respond to the client would be, I see there is a lot of, I see that you're going through a lot of pressure from the other, like from outside, and you need somebody to understand you
Mm-hmm.
and
Yes.
support you instead of making you feel that your thoughts are not valuable is.
Perfect. Perfect. Would anyone else want to take a um, go with this? Yes, all of you can lower your hands. Like, yeah. Would anyone else want to take a go with this?
I would ask the student like what exactly their parents are expecting from him or her, like why he or she is feeling so pressure and what they are trying to tell them or what they expect from him or her.
Okay, Sunita. Okay, okay. Thank you for that. Anyone else? Okay. So yeah, that I hope we are clear till here, till this topic of reflection and paraphrasing. I'm taking that as an yes. Thank you so much. Now, okay, summarizing. Now, in terms of summarizing, once a person has completely described what is bothering them and their thoughts and feelings around whatever it is the situation, they may continue to describe the same in different words as they want to make sure that they have been understood. Okay. Now, summarizing everything that they have said to you so far, each situation, along with their feelings about it, in a more concise form, can convey that you have been listening to them and you have understood what they have to say. Okay, when summarizing, it is really helpful, phrase the starting of the sentence in a way which goes, hey, correct me if I'm wrong, I have understood ABC, XYZ, all of that. Or using this using this other statement like, am I right in saying that this is what has happened? Or is it safe to say that is it safe to say that you're feeling stressed right now because of the pressure that your parents are putting on you, well, in terms of exams that are coming around? Or the one best method that we can use while summarizing is that please feel free to stop me if I have misunderstood you, and continue on what you have understood from that. Okay. Now, we understood till now we spoke about I'm so sorry. Yeah. Till now, we spoke all about what is communication, how do we communicate, what are the communicating skills, and everything, right? Now, we'll speak about what are the challenges and how do we overcome them. One is cultural and linguistic differences. They can present significant challenges in communication between counselors and clients. Okay, counselors. Sometimes we may not be able to speak the language that they speak. Sometimes we may not be able to be very fluent in the language that they understand. Sometimes the client is multilingual, but then again, it finds them tough to understand something what we are saying. Okay, it is our responsibility to make sure that we are very clear. If at all we are not in a situation to provide for the client, it is our responsibility to refer them to someone. Okay, managing emotions. Yeah, managing emotional intensity and resistance. Yes, resistance comes from the client. It is very, I would say, simple thing. It's a very common thing that the client comes with resistance due to stigma and everything. And it is also important for us to understand that the client comes with a lot of emotional intensity. So it is our responsibility to navigate that in a very effective way. And one of the best way to do that is through communication, dealing with silence and non-verbal cues. Sometimes what happens is while sharing something, the client goes completely silent after sharing something. There will be a very like there'll be very awkward silences, very awkward silences in terms of therapy sessions because because the client stops while sharing because they feel emotionally intense. At the same time, they don't want to show that they're emotionally intense. So, all of that, taking all of that into consideration, we should be comfortable. As a counselor, we should be comfortable with the moments of silence and, yeah, with the moments of silence that the client is showing. And it is important to understand, to look for non-verbal communication cues such as the body language, their facial expressions, the tone in their voice. Sometimes it is very, I think, yeah, sometimes we as a counselors, we tend to see that while someone is speaking about something, there's a difference in their voice. Their voice, there's a kind of shiver in their voice, or there's a kind of fear that comes in their voice. It is important to note that. Okay, balancing directive and non directive communication skills. Okay, counseling. Okay, we every counselor has their own approach towards counseling and balancing both directive and non-directive communication skill styles. It involves adapting the counseling approach to meet the client's needs, their preferences, their readiness for change. Okay, and okay, I'll tell you on directive techniques to help understand. Directive communication is more of an example of providing psychoeducation, offering guidance, whereas non-directive approach is exploring client's perspective, facilitating self-discovery, self-efficacy, and all of that. Okay, now navigating power dynamics. The one thing that is very important for us to keep in mind is that client should be in control. We should never, ever, ever take the control to us. Client should always be in control in terms of therapy sessions because it makes them have that sense of control that would help them go forward in terms of their goals in a very effective way. Okay, encouraging clients autonomy, respecting their whole perspective and collaborating with them in terms of decision making, uh, setting up the goals, navigating on how to reach the goals, that can help them mitigate power differentials, and it can enhance clients sense of self determination. It can also show to the client that they are self determined, they are self sustainable, they can, do it on their own. Okay, I am really sorry. Can you all just give me 1 minute? I'm really sorry for this. Just 1 minute. Yeah. So sorry for that. Okay. Now, coming to resolving misunderstanding and conflicts. Okay. We are humans. We get it. We there is a whole big saying, a very small saying that goes to err is human, right? It is very important to understand that we as counselors, there are very high chances that we make mistakes, and that's all right. There are very high chances that we might want to communicate something and we do communicate something else, and that's all right. There are high chances that the client might take it in a whole different way, and that's all right too. Now, once the mistake is done, instead of sitting and dwelling on that, how do we resolve it? How do we manage the conflict that has happened? How do we again, reform the therapeutic alliance. That is important. And how do we do it? Is by actively listening, clarifying the perceptions, clarifying the intentions, seeking mutual understanding, and using the very effective term, I am sorry. This term, I'm sorry, it makes the client understand that we are humans too, and it makes the client understand that it's all right. Mistakes happen. Okay? Now, yeah. Now, ethical considerations in terms of communication. This is very important. While we are communicating, it is very important for us to remember the confidentiality, remember to set boundaries, remember consent is very important, informed consent, and professional integrity that we follow. Confidentiality, again, we all are aware of confidentiality. We all are aware of boundaries as well. Coming to informed consent is an ongoing process through which counselors inform clients about the nature, the purpose, the risk, the benefits of counseling. And counselors should obtain voluntary consent before initiating treatment or before initiating the whole therapy process, and periodical review of it should happen. And professional integrity, it encompasses the honesty, the transparency, the ethical conduct, and all of that. Okay. Now, yeah, as I've told you earlier, I am a very book person. So I really recommend you to read these two books. One is The Skilled Helper by Egan. This is one of the book that completely emphasizes on active listening, thoughtful questioning. It has a very cute, oh, not cute, sorry, yeah. It has a very effective, the three stage model, current scenario, preferred scenario, and action plan. This would really be helpful in terms of you know navigating through the whole counseling sessions and everything. The other thing is motivational interviewing. Oh, this is one of the book that that I actually go to whenever I feel like I should get back in touch with my basics. Uh, it it emphasizes on it completely focuses on emphasizes on collaboration between the therapist and the client, the empathy, the practical strategies that are there, and how to engage with clients in a very meaningful conversations, so on and so forth. So yeah, I really recommend you all to read these two books. Now